there are things that you can do to prepare yourself, to prepare your body to have a better birthing experience, even though we can't guarantee things. So things like perineal massage, because we know 85% of women in the UK will have some form of perineal trauma. That sounds like quite a scary statistic, but the majority of those women it's just going to be, a very small amount of trauma that just affects the skin, okay? Occasionally, it can be a bit more serious than that, but most people who have any tearing perineal trauma, it's very slight.
Yeah. And what do you think about perineal massage? Is that important?
Yeah, so I'm a big advocate of perineal massage, and I'm always talking about it. There are studies that have shown, that have proven that actually people who do a perineal massage several times a week from about 34, 35 weeks onwards have a significantly lower rate of perineal trauma. So that's episiotomy or having a tear. Yeah. And I did perineal massage with my last 2 children. I've never torn with any of mine. I've been very, very lucky, and I do put a lot of that down to the perineal massage that I did. And aside from it reducing the risk of trauma, I think it actually helped with the birth process, with that second stage and the baby's head kind of gently coming out. So I think it helped with that. And then that has a knock-on effect for the healing period afterwards. If you don't have any perineal trauma, you don't have to worry so much about the way you're sitting down and moving around. And
it's like healing in the postnatal period can be so uncomfortable and so difficult for so many women, and it can sometimes take a lot longer to heal, can't it, than you expect. And it can be difficult to keep everything.
Exactly. So and that's one of the reasons why I am a strong advocate for it. And all the conversations I've had with people who have done it have been quite positive. At the end of the day, when we say significantly lower risk, it doesn't mean no risk of tearing. Sure. It just means that the chance is lower. And at the end of the day, if you can do a perineal massage, then why not? It's not gonna, it's not gonna be detrimental. It's not gonna hurt.
No, exactly.
I'll give it a go.
And it can feel uncomfortable the first few times you do it, but then you sort of relax and get used to it, and and if you keep the benefits in mind, then that can really help.
I think the main thing is to get into a position that's comfortable for you, when you're doing it. So maybe 1 foot up on the toilet seat or something.
Yeah. Well, some people I know involve their partners, but I don't know. That depends on the kind of relationship
you like that kind of thing. If your partner's happy to do that, then why not? So some women have actually said to me about perineal massage and asking me if it hurts, if it's uncomfortable, and what I can say is, from personal experience, no, because what you need to do is you need to listen to your body. And when you're actually doing the techniques for perineal massage, if it's starting to hurt or sting, then you need to stop and just, ease off. It shouldn't hurt. So ease off the pressure a bit. Because what you don't want to do is you don't want to cause any perineal trauma yourself. Yes. You don't want to hurt the area. So I'd always say just ease off a little bit if there's too much pressure there. And then you just listen to your body, because it shouldn't be uncomfortable. It shouldn't be uncomfortable.
And make sure you're using the right product to do it with.
Exactly.
And nothing that's going to cause any irritation or sensitivity or something that's been gynecologically approved.
Exactly. So make sure you're using a product that is designed for that purpose, and making sure you're doing it several times a week as well to have the maximum benefits.
And do you think that gives you more confidence going into labour, knowing that you've done something like that?
Exactly. And also, some people will say to me, I did perineal massage, but I still had a 1st degree tear. But actually, my response would be, well, if you didn't do it, there's four degrees of tearing. You've got 1st degree, 2nd degree, 3rd degree, and 4th degree. Now we know that 3rd and 4th degree are the more serious tears that require repair in theatre. 1st and 2nd are the more insignificant tearing. So to have a 1st degree tear is actually just like having a little graze on your skin, which really heals in a couple of days, and it's not really a big deal. So if you've done perineal massage, but you have a very small 1st degree tear, well, actually, if you didn't do it, who knows? Yeah. Who knows?
Yeah, it's worth giving it a go.
It's worth giving it a go.
There's no harm.
Yeah, absolutely.